We are live.
Hello, everyone. Okay,
Good
hello,
evening.
everyone.
Good evening to all. I welcome you all in today's Facebook Live session. Thank you for joining with us. Today, we have with us Dr. Manjeet Bhati, who will be taking us through the management and treatment approach on fatty liver. Dr. Manjeet Bhati has done his MBBS, DNB, and DN gastroenterology, and he is currently Senior Consultant Gastroenterology and Liver Specialist at Gut Care and Liver Specialty, Ghaziabad. So without any further ado, I would like to hand over the session to Dr. Manjeet Bhati. Sir, over to you.
Okay, thank you, everyone, and very nice and good evening to all the participants and the viewers. I am Dr. Manjeet Bhati. As you already got my introduction, I am a gastroenterologist. I usually deal in the diseases pertaining to liver, pancreas, GI tract, and overall a good gut health. So today's topic of discussion is basically a good liver health, fatty liver, the causes of fatty liver. I will take you one by one through the causes of fatty liver, what are the risk factors which are associated with fatty liver, what are the consequences of fatty liver, what is the treatment, what are the complications, and what can we do not only to treat the complications but to prevent the development of complications in future. I'll not keep it very long. I will not keep it very scientific. I'll give you a basic overview so that you are also interested. So fatty liver, as the name implies, is nothing but the fat in the liver. Now, to say what are the causes of fatty liver, where does the fat come from? So there are many reasons. It can be obesity, basically overweight. It can be related to drugs. It can be related to alcohol intake. Alcohol can cause increase in the fat in the liver. It can be genetic. It can also happen in children, not only the adults. And in India, we have a special entity which is known as lean NASH, which is individuals who are thin but still can accumulate fat in their liver. So basically, why the fatty liver is very important to us? Because there is an entity which is known as cirrhosis. As some of you may know, cirrhosis can cause irreversible and permanent damage to liver. And the outcome is, of course, because it is irreversible and permanent, the outcome is very, very bad. And the ultimate treatment left is only liver transplant. Now, if we go and look back some 15, 20 years back, the major causes of cirrhosis was alcohol. Then around in the early 90s, early 2000, we had discovery of hepatitis B and C virus, which became one of the major causes of liver cirrhosis. Now, over the past 20 to 30 years, there has been a change, a paradigm shift, basically, in the etiology, the cause of cirrhosis. Now, as we see, our children, us, we will see that NASH or NAFLD, that is fatty liver, will become one of the emerging causes of liver cirrhosis and liver cancer in future. Due to our lifestyle, due to inability to move or exercise, bad consumption of food, bad hygiene, excessive alcohol intake, the fatty liver will, in a few years, actually it has already overtaken alcohol and hepatitis B, C as a leading cause of cirrhosis and cancer in liver. It will definitely in future, and maybe another 10 to 15 years, it will definitely overtake these major causes. So that is why we need to be so sure that we have to find it early, we have to treat it. Because one way or the other, we will face it in future. Us or maybe our children. So this is related to the etiology. We should know that overweight, obesity, drugs, alcohol, everything causes fat in the liver. So why is fat so damaging? Because fat, basically, to summarize it, fat causes damage to the liver cells. And because of the damage and oxidative stress in the liver cells, there is a regeneration of the liver cells. That regeneration is very aberrant, that causes fibrosis, and the liver is not able to perform its function, and that abnormal fibrosis and aberrant regeneration becomes a focus point for development of cancer also. Now, what to do? Now, how to approach this dilemma? How to treat it? Now, basically, I say right now we don't have too many drugs to treat NAFLD or NASH. NASH is non-alcoholic steatohepatitis. I will discuss further what is NAFLD, what is NASH. Basically, we don't have much drugs in the pipeline. So right now, it is a combination of lifestyle modification, and drugs and exercise programs. What I usually tell my patients, what majority of the patients of fatty liver look like are, they are obese, they are overweight, they have a job like mine where we sit on our chair all day long, we do not exercise, and we have very abnormal eating habits, we do not have normal sleeping times, we do not get rest, so that causes sort of stress on the liver, fat accumulation in the liver. So that is the primary thing we should target. We should mainly target at losing weight, having optimum nutrition, increased protein in the diet, a reduction in the carbs and fats. Other than that, that is one of the most important things other than the drugs. And as I already told, this in an entity which is known as lean NASH. That is a lean or a very thin individual can have fatty liver. Many of my patients, they come to me, they say, sir, मैं तो मोटा नहीं हूँ, मेरे को फैट क्यों है लिवर पे? मैं बोलता हूँ यार ये एशिया में ही होता है. A lot of research is being done in Kolkata, in the hepatology centers, and they have found that this entity is very, very much found in this part of the continent, Indian subcontinent. And beware, even in lean individuals, even in thin individuals, fatty liver can cause damage, cirrhosis. So we have to act fast. We have to look at the symptoms of fatty liver. So what are the symptoms of how do you know that I have fatty liver? Of course, I've already said that risk factors are, you might be an obese person, you might be middle-aged man or woman, have a risk factor such as diabetes, hypertension, some alcohol intake, basically metabolic syndrome. The metabolic syndrome is an entity in which there is a risk factor which causes fat accumulation. So a diabetic person, an overweight, obese person, an hypertensive person that has a metabolic risk factors, this is known as metabolic syndrome, which causes excessive fat accumulation in the liver. So we have to target those people. We have to find them. We have to do tests, identify risk factors, reduce those, treat those risk factors, from them to reduce weight, have a better diet. So that is one part of the treatment. And now the new modalities have come in which we actually catch NAFLD or fatty liver first. And one of them is fibroscan or liver elastography. Recent newer fibroscan machines, they also quantify fat assessment. They give us an absolute value of fat, how many grams of fat is present in the liver. And they also, of course, tell us about the fibrosis or reversible damage. So those tests can be done if you consult your hepatologist. And though we are telling about NAFLD and NASH. NAFLD is nothing but non-alcoholic fatty liver disease. A person does not take alcohol in the significant amount, develops fatty liver, so that is non-alcoholic fatty liver disease. Not all the patients of fatty liver go on to develop inflammation, that is NASH, that is non-alcoholic steatohepatitis or liver inflammation. A minority of them do develop NASH, and even minority develop fibrosis or cirrhosis, and lesser amount go on to develop hepatocellular carcinoma. So that is very difficult to trace. कि कौन किसको NASH होगा, किसको cirrhosis होगा, किसको cancer होगा. So better सबको treat करो. That's how we approach NAFLD. Because if you look at large amount of data in India, जहाँ पे 100-150 करोड़ लोग रहते हैं, so उसमें अगर एक minority भी होगा, आप 2%, 5%, 6% पे लेंगे, that becomes a big chunk. तो इन चीजों में जब हम बात करते हैं, तो one of the treatment approaches is, of course, lifestyle modification and dietary modification, weight loss, and treatment of the comorbid factors, as obesity, diabetes, hypertension, hyperlipidemia, hypercholesterolemia, etc. Other than that, there are many newer drugs which have come in the pipeline for the treatment of fatty liver. But usually I say, if drugs are needed, of course, that is just a small part of the treatment. You have to reduce your weight, and then the drugs come. You consult a hepatologist; they will prescribe you drugs. But remember, always drugs will not work alone. You have to lose weight. You have to reduce the risk factors. You have to treat the comorbid conditions. Only then you can target. So as I was saying, basically NAFLD होता है, non-alcoholic fatty liver disease होता है, inflammation होती है, steatohepatitis होता है, बाद में fibrosis, cirrhosis होता है, and after that they go on to develop complication of cirrhosis, including hepatocellular carcinoma, cancers of the liver. And once you develop cirrhosis or the cancer, there is no treatment left other than the liver transplant, and these treatments are very costly. And in India, it is very difficult once you develop cirrhosis to get treated because there is lack of insurance, there is lack of facilities. Only in the tier 3 cities there are facilities available. There are no hepatologists or gastroenterologists available. And even not only the general public, even the physicians day to day, they are not well aware with the cost burden of this disease even before the cirrhosis develops. Now, one of the most important symptoms of fatty liver, which I have experienced in my OPD case in my personal practice, is lethargy or weakness. In simple terms, I will say that fat is just not fat. Fat in liver is an endocrine part. It secretes hormones, active substances. Liver, when it is loaded with fat, those things, they go into blood. They create a perpetual milieu of inflammation. और सूजन जिसको बोलते हैं, perpetual milieu, एक inflammation रहती है body. That causes these varied symptoms: weakness, lethargy, lack of energy, anhedonia, depression, a persistent pain in the abdomen because the liver is heavy. It constantly hangs down. So once you have these symptoms and you fit that profile of that patient having fatty liver, you should definitely get a doctor for fatty liver and talk to your hepatologist. Now, and I would also say that in India, it is a general tendency to go for desi medicines, to not take them, because ultimately they do more harm than benefit. They are not tested and tried. And of course, I would say that is your choice, but still, you should consult a hepatologist or at least a physician before embarking on these desi medicines. And because they can cause liver damage. Most of these desi medicines, they have very high level of heavy metals, including cadmium, mercury, arsenic, bismuth. And these are not quantifiable. So before taking these medicines, you should always consult a physician, because in long term, they do more harm than benefit. So don't, if you don't want to take medicine, just lose weight. That will do 80% of the work. One of the most important things. And I think that covers the basics of NAFLD and NASH and its treatment, I think, for the public. Rajat?
Right. Thank you so much, sir, for such.
Yeah, if you have any questions, then I will take them, because once you start talking on fatty liver, NASH and everything, it becomes a long, boring topic. मैं लोगों को bore नहीं करना चाहता. Rather, I'll take a few questions which will be, I think, more interesting and which will be more informative than just a monologue. Just I'll keep talking. So
right.
It's better I take questions, right?
Absolutely, sir. Thank you so much, sir, for such a lucid talk and explaining fatty liver in the simplest possible way. So we have few questions. I'll take it up one by one.
Okay.
So, sir, the first question is, what are the food that we can eat for preventing NAFLD and NASH?
Okay, that's actually a good question. One of the most common questions I face. It's very simple. Don't take fat, don't take carbs. अब इंडियन डाइट में फैट और कार्ब्स किस में होता है? चावल, आलू, तेल. Don't take it. लोग बोलते हैं सर कौन सा तेल बिना उसके टेस्टी खाना बनता नहीं. Okay, you can try maybe Mediterranean food sort of diet. आप थोड़ा सा ऑलिव ऑयल ले सकते हैं. But still, बेसिक है कि फैट बहुत नहीं लेना है, कार्ब्स बहुत नहीं लेने हैं. Anything which is loaded with carbs, junk food. चिल्ड्रंस में NASH, NAFLD बहुत कॉमन हो रहा है आजकल. आप यकीन नहीं मानोगे बच्चों में फैटी लिवर मिल रहा है. Which is actually kind of sad, because junk food बहुत खाते हैं बच्चे आजकल, घर का खाना नहीं खाते. So avoid junk food, and of course avoid alcohol. Alcohol also causes accumulation of fat in liver, and avoid anything which is loaded with carbs. And चावल हो गया, राइस हो गया, पोटैटो, आलू, बहुत तली भुनी चीजें नहीं खानी है. Just follow a high, it's very fundamental. Just follow a high protein, high fiber diet. High protein diet vegetarian हो जाएगी आपकी, all the pulses, soybean and paneer, which is a high fiber, high protein diet. Fibers which is including all your natural resources जो भी आते हैं, फल होते हैं, fruits होते हैं, vegetables होते हैं, those all you can take. And cut down on your rice and roti or rice के intake को थोड़ा सा cut down करो. I think that will cause a good amount of weight reduction. Lack of energy भी feel नहीं होगी, because there is good amount of fiber and protein in diet, and I think that will work for you.
Right. So the next question is, I don't drink alcohol and my BMI is ideal. Can I get fatty liver?
Yes, as I said, there's an entity in India which is known as lean NASH, which is lean मतलब आप जानते हैं पतला, NASH मतलब non-alcoholic steatohepatitis, यानी पतले लोगों को भी NAFLD यानी कि fatty liver होता है. ये हमारे इंडियन सबकॉन्टिनेंट में ही मिलता है देखने के लिए. So of course you can get it. Now it's very difficult. We cannot test everyone. So I think you should look on for the symptoms. There's a constant dragging pain, heaviness in the right part of the abdomen, upper part, so that can tell fatty liver. There is weakness, lethargy, kamjori rehti hai, energy nahi rehti kaam karne ki. So all these patients should get doctor for fatty liver. And of course, if there is a family history, there is family history of diabetes, there is family history of liver cancer, there is family history of liver cirrhosis. तो इन सब केसेस में यू शुड ऑलवेज गेट वर्क फॉर फैटी लिवर. अपना एक नॉर्मल अल्ट्रासाउंड कराइए, देखिए फैटी लिवर है कि नहीं है. अपना लिपिड प्रोफाइल कराइए, एलएफटीज कराइए, एलएफटीज में डीरेंज है, एलएफटीज लिवर इन्फ्लेमेशन तो नहीं है, लिपिड प्रोफाइल डीरेंज तो नहीं है, शुगर और थायराइड का वर्कअप कीजिए, और अपने फिजिशियन से बात कर लीजिए, ही विल गाइड यू.
Sir, next question is fatty liver reversible?
Yes, definitely. Fatty liver is 100% reversible. Even NASH, because मैंने आपको बताया कि जब फैटी लिवर उसके 3 स्टेजेस होते हैं. फर्स्ट इज NAFLD, नॉन-अल्कोहलिक फैटी लिवर डिजीज. नेक्स्ट इज NASH, नॉन-अल्कोहलिक स्टीatohepatitis, जब इन्फ्लेमेशन सेटअप हो जाती है. देन देयर इज फाइब्रोसिस, सिरोसिस, व्हिच इज इरिवर्सिबल. सो इनिशियल 2 स्टेजेस देयर इज रिवर्सिबिलिटी. It is simply fatty liver, there is no inflammation, there is good amount of reversibility. Follow good diet, lose weight, use drugs with caution, consult your hepatologist. Once you develop hepatitis, that is fusion, NASH हो जाता है जब fatty liver की वजह से, there are deranged LFTs. Still that part, if you keep losing weight, वो inflammation कम हो सकती है. The problem comes when you reach to the stage 3 and 4. Once the fibrosis develops, now that is little tricky, little difficult to treat. I think we cannot cover it here. Consult your hepatologist. Get your test done. Yes, it is 100% reversible.
Okay. Sir, next question is, I have grade 2 fatty liver and my age is 44. Can yoga and other exercise alone can help me to overcome fatty liver, or medications are required?
Okay. I will say exercise alone is more than enough. देखिए, अगर आपकी ग्रेड 2 फैटी लिवर है, सबसे पहले तो आप एक फाइब्रो स्कैन कराइए, लिवर इलास्टोग्राफी विद कैप. First quantify the amount of fat present and if there is any fibrosis, grade 2 and grade 3, because ultrasound से अगर आप grade 1, 2, 3 quantification करते हैं, that is very non-specific and a very objective, subjective test. कोई ultrasound grade 2 बोलेगा, कोई grade 1 बोलेगा, तो पहले fibro scan कराइए, देखिए कितना fat है उसमें, liver में. If the fat is too much, then you should do both exercise and medicines. We have good amount of medicines, such as right now we have obeticholic acid, we have saroglitazar. Now, saroglitazar is one of the more common medicines that I use in my personal practice, and that is bilepsa, and that helps in reduction of fat over long term, so over a period of 3 to 6 months. So, पहले टेस्ट कराइए, अगर आपको ग्रेड 2 फैटी लिवर है, फाइब्रो स्कैन कराइए, देखिए कितना फैट है लिवर में. अगर फैट काफी है, तो ड्रग्स प्लस एक्सरसाइज प्रोग्राम विल हेल्प. अगर फैट बहुत ज्यादा नहीं है, which is unlikely, ग्रेड 2 है तो फैट आएगा लिवर में काफी, so that exercise alone is more than enough. Or weight loss. Essentially, we yoga plus exercise in whatever combination you want.
Sir, next question is, what are the other health risks associated with fatty liver?
The risk factors I've already told: obesity and all the components of metabolic syndrome, diabetes, hypertension, and overweightness. Then smoking, alcohol intake, anything, even drugs, chronic steroid abuse. There are certain people who are on chronic diseases who are on steroids. Steroids can cause fatty liver over a long term, not of course not on the short term, but over a long term, over years. And as I said, certain other drugs and alcohol, obesity, etc. Those are the common causes of fatty liver.
Right. So next question is, which type of cooking oil will be good for healthy liver?
I would say कि as such इस पे कोई बहुत रिसर्च हुई नहीं है, and but I would say कि आप ऑलिव ऑयल यूज कर सकते हैं, but oil is oil, and ऑलिव ऑयल में थोड़ा सा ओमेगा 3 फैटी एसिड ज्यादा होते हैं, which are little helpful, but fat oil it's little more animal fat is little more dangerous than plant oil, and जो भी ऑयल यूज करें कम यूज करें. You can use any oil, just use it less.
Sir, next question is, should I get my liver tested even if I am healthy? And if yes, then how often?
It depends on your age. It depends on your risk factors. अगर आप young हैं, पतले हैं, lean हैं, alcohol नहीं लेते हैं, किसी chronic drugs पे नहीं है, then of course not. कोई symptoms नहीं है, such as jaundice नहीं है, pain नहीं है, lethargy नहीं है, weakness नहीं है, कोई comorbid condition नहीं है, कोई family history नहीं, तो क्या जरूरत है? एंड ऑफ कोर्स अगर आपको एज ज्यादा है, मोर देन 40 और 50, ऑफ कोर्स लिवर टेस्ट कराइए. डायबिटीज है, लिवर का टेस्ट कराइए. अल्कोहल लेते हैं, लिवर का टेस्ट कराइए. फैमिली हिस्ट्री है लिवर डिजीज की, अपने लिवर का टेस्ट पक्का कराइए. किसी ड्रग्स पे हैं व्हिच कैन कॉज फैटी लिवर, स्टेरॉइड्स हो गए, एनी ड्रग्स, लॉन्ग टर्म ट्रीटमेंट में अपने लिवर का टेस्ट कराइए. So a young person with no comorbidity, कोई comorbidity नहीं है, किसी ड्रग्स की नहीं, कोई सिम्टम्स नहीं, तो need not, everyone does not need to be tested.
Sir, next question is fatty liver a lifelong disease?
Fatty liver is a disease of what do you call? I will not say it's a lifelong disease, but fatty liver is more of a disease of lifestyle. So अगर आपकी लाइफस्टाइल गंदी है तो लाइफलॉन्ग है, और लाइफस्टाइल अच्छी है तो टेम्पररी है. As simple as that.
Sir, next question is, can children develop NAFLD or NASH?
Yes, definitely. We have seen many cases in which children having fatty liver and even develop steatohepatitis, and in long term, over a period of 10, 15 or 20 years, they do develop cirrhosis. So in children, we have to keep a lookout, particularly in today's diet, कि बहुत ही ज़्यादा बाहर के खाने and fat diet होती है, and तो obesity, bad diet, poor exercise. So you should look out on that. Of course, मेरे ख्याल से obese बच्चों का regular ultrasound कराना चाहिए, LFT कराना चाहिए, and of course if any kid, any child is on any chronic medication, उस वक्त भी liver का एक बार workup होना चाहिए.
Sir, next question is, how can we define an overweight and an obese person?
We have different Indian and Western standards. We have BMIs हम calculate करते हैं, and BMI से हम देख सकते हैं Indian standard is different, Western standard is slightly different, and overweight is around 29 to 30 से BMI ऊपर होता है तो overweight होता है, 35 को obesity होती है, and morbid obesity होती है more than 40 centimeters. It's all available online, and I think an ideal BMI should be less than 24 or 25. 25-30 के बीच में it is overweight, more than 30 it is obesity. Sorry. So BMI आप आराम से कैलकुलेट कर सकते हैं, just requires your height and your weight. Online calculators available है. अपना weight और height तो of course you cannot change. You can track your weight, put it on the online calculator, calculate your BMI, and that's it. अपना BMI 24-25 के नीचे रखिए. इंडिया में थोड़ा सा कम रखिए, because we have a tendency to develop fat at a lower BMI. That is more important to understand.
I will take last few questions. So, sir, the question is non-veg food harmful for fatty liver patient?
Okay. So non-veg food क्या होता है? जैसे non-veg में fish आती है, non-veg में chicken आता है, non-veg में mutton आता है, non-veg में beef आता है, अंडा आता है. To my patients, I say non-veg is actually good, not bad for fatty liver because it contains protein. But caveat है, it should not be cooked in oil. बहुत ज़्यादा तेल नहीं होना चाहिए. Now, जो लोग non-veg खाते हैं वो जान सकते हैं कि mutton, of course, cannot be cooked without oil. बटर चिकन बिना बटर के नहीं बन सकता, तो बटर चिकन मत खाओ. चाहे चिकन सैलेड ले लो, फिश ले लो, बॉइल्ड एग ले लो, एग योक मत खाओ. So that contains good amount of protein without fat. So that will not be harmful for the liver. अगर आप बटर चिकन खाएंगे तो that contains a lot of fat. अगर आप मटन पाके खाएंगे तेल में तो उसमें तो फैट है. So that will be harmful. तो फंडा है प्रोटीन ले लो, फैट मत लो. So non-veg खा सकते हैं. Non-veg is actually not bad. It's actually good for liver. We often prescribe amino acids, BCAAs to our patients of liver cirrhosis, a high protein diet. In fact, to the patients of liver cirrhosis. In fact, अगर आप plant-based protein is actually very good for liver cirrhosis. तो non-veg खा सकते हैं, but of course तेल नहीं होना चाहिए. It should be less oily.
Okay, sir. The last question is, what is the role of thiamine in fatty liver?
Not ऐसा कोई रोल नहीं है. Upcoming role. If you want to ask me, किसी भी multivitamin का इस वक्त fatty liver में कोई रोल नहीं है, किसी antioxidant का कोई रोल नहीं है fatty liver में. It is all under investigation. Lot of drugs have been under investigation, zinc, selenium, etc. So which are antioxidants basically, but उनका ऐसा कोई रोल अभी तक आया नहीं है, ना ही कोई ड्रग related pertaining to it कोई अप्रूव हुई है. So don't take a lot of multivitamins because multivitamin toxicity हो जाती है. फिर just follow normal routine. That's it. fatty liver कुछ नहीं करना है. Lose your weight, follow a good diet, a protein based diet. That's it.
So that's it, sir. Thank you so much, sir, for addressing all possible queries. And
Thank
thank you so much for such an insightful session. And I'm sure fatty liver patients and their caregivers will be very happy today, because this session must be very helpful for them as well. And I
I'm
would
happy
also like
to.
to, yes, thank you, sir. And I would also like to thank our all participants for joining us. And to stay updated on liver health and to know more about fatty liver, please like and follow our page NASH 24 by 7. Thank you so much. Thank you so much, sir, once again for for taking this session.